all the June Health Committee meetings to order. 9:40 a.m. First item of business, public comments. Are there any public comments? Seeing none, we'll move on to the next item, and that's the agency reports. Last month, we drafted up a letter and sent out to all the agencies that we encompass. And it's with a volunteer basis, and I think we're going to have, if you're not on the agenda today, please speak anyway. You're welcome, everyone. Hopefully within the next few months, all the agencies will report. I know there's some next month and some following month. We'll start with volunteer services. Just introduce yourself and. Just, however you want to do it. You want to summarize or?
Obviously, we're a senior citizen agency. That past year, we all helped over 1700 seniors. A lot of these seniors come into our office 3 or 4 times a year, not more, probably 3 or 4 times a month, actually. And we also have a grant to help a big person and then we talked to like if there's any kind of program through the building and splitting into a role in the Party plan, and we have another 350 more person on if they have a right plan, we'll help them on how to get a lower referral contract. Talking to my doctor about pill and access to the alternative. We have 49 clients who do extra help need for the our Part plan, and we're still doing the 56 clients on helping pay for their Part D premiums. Right now we're working on our funding for the 2015 big grant to the area agency on Central area agency on engagement, and our funding level should be the same as what we were this year for our senior education program, and we'll be getting a little bit of an increase for our caregiver advisory and grandchildren program. These grants are more wireless cash, and grants for our foundation out of Shelburne, Illinois. The care program, we have 81 months, active 81 clients right now, and we employ 16 service approximately 1,250 hours of service a month. They would only just given about a 6-day turnaround on about hours as opposed to the 7 months that we were looking for in practice.
Very good. Any questions? The next one on the list is ABRA. Suzanne Light.
Copies of our audit from last year. I brought 2 copies, and then I brought some informational packages that explain our agency along with the current financial report. ABRA is located in Sheldon, and we operate SILAs for people with developmental disabilities. We have 2 homes in Sheldon and 1 in Watsika. We provide services for 8 people. The monies we received from the 377 board were used to supplement our supported employment program, because while the state pays us for job coaches while they're on the job with the people served, they don't reimburse us for travel time or for much of the travel expense. So that's where the monies from the 377 board help supplement that program. Out of our 8 clients, 6 of them had community jobs in 5 different communities, and they've had 14. We have 14 different jobs that these 6 people work at. In addition to the SILA program, we also are a satellite clinic for the Iroquois Mental Health Center. The Sheldon Food Pantry is located in our building, and we collect the water bill payments for the village of Sheldon. We're funded through the Department of Human Services, plus donations and grants.
Thank you. Are there any questions, comments? Next is 708 Mental Health Board, Dr. Dennis Hopkins.
talk a little bit about the history of how our agency came about. And we look back in the 50s and 60s, there were 6 state hospitals. And in those state hospitals, they were going in at one point where there were 600,000 people born in each of those facilities. And there was a lot of question as to what kind of services they were actually needing. And we look at them realistically, and some permanent physician can come in and say, all right, everybody here is going to get electroshock therapy. Everybody here is going to need medication that's some kind of specific or rural. And you say basically you're getting that kind of services with custodial care, and you are outside of my reasonable community. It didn't seem like a really productive way to handle situations that cost everybody a fortune. Today, you would send somebody to sit with one of these facilities. You're looking at probably at this $5,000 a year. How is someone to pay for that? So, the state said, let's go to community mental health, let's set up different arrangements, let's set up community mental health centers, and let's start the process of the institutionalization. So instead of that, set up community mental health centers for private business, because they really didn't want them to be in the general ones, while they put ones, especially the state. They wanted to be able to earn money, make money, provide service, quality service, be audited by a lot of government boards, and were if you're accountable for what they actually provided to the business so they could actually improve the community and see. So 10 years ago, at one point in my life, I was treating mental health services, and I was drafted, I guess probably the nicest word, into Springfield, to set up mental health services in the prison system. So I did that. And there was an incredible situation because suicide was running rampant. So I'm going for this prison setting stuff up. And thinking after, well, why did they do this? And I looked into the community health center, because you couldn't get into the community health center. Always a waiting list. And you got in, it was service equivalent to what you would get on private sector. And when I came here 10 years ago, our waiting list was routinely 50 people. You couldn't get in. We had crisis services going on day and night, trying to catch up to that and the other. People weren't being seen. I think, realistically, one of our top therapists was seeing like 2.3 people a day. And suicide rate, which is probably one of the biggest reasons why we got tracked sometimes in the county, the suicide rate was back then 26 people a year, which made this county the third highest in the nation. So you got to do something different. So, and knowing that we're a private business, and that we can make money from the way, rather than keeping a hand out all the time, we started looking at different forms of revenue. Fortunately, the state system was changing. It went from blind and alcohol, in which we would get X number of dollars each month to pay all the bills. Whether it was not one person or about 100, to a piece of service model, in which we had to see people in order to pay, and then to manage care model, which basically took it out from state dollar. And so now, we really don't deal with much with the state. We have small contracts with them, and we like about it, but really, the people that are customers of the managed care, which is your insurance company. So we went in changing the model. It was like, okay, no more waiting lists. We went to, our hours were extended Monday through Friday, 8 to 9, Saturdays and Sundays, 8 to 5. And so now we just kept pushing the issue of the meetings. And that's how we operated that. If you look at some of our latest figures, the problem is too, that during the course of I don't know, year 3 to year 6, 7, we're trying to transition, we're accumulating a whole bunch of debt. Even though we're getting the money to sell money to work like that, we just so for the first time we kept working at different arrangements. We managed care, PPC, nicely, care, that kind of versatile. But people come to the agents now, and actually have some type of insurance. So that is very helpful. That 10 years ago, one family coming into insurance. Now everybody has some form of insurance. With that, we see, we go that up so that 30% of the people we see are actually private pay or private insurance. That helps us tremendously. And I also saw a lot about our clinic because some of the neighbors are coming to see us. And we're getting fantastic data that I think is comparable to what you get in our private sector. And that's our private sector operation. The point is, this contracts with the companies where the first free session free, and then that's on the insurance plan. So when we look at what is all this mean for you and actually true. If you look at page 13 of this book, it's not unusual for us to, in the day, you have hundreds of clients and you can see in here where this is September, this is on other degree. And we're looking at this year, the 2014, the payments, came to a certain way here, and represents 30% of the total, for revenue, the total of 20,250 was service hours, divided by the second. Something like we're trying to do the services is the price of $27 a day for 4 hours. And on an annual basis, it comes out $178 per client, which I think is a lot of users. And again, this is what they make, which is why we're able, sometimes she gets a little something, it drives down the other costs, the income costs, everything. And so how it work. In years ago, the only costs coming in, the only revenues coming in, was simply saving money on selling whiteboard. And there was never enough. You know, you always need more money for this, more money for that, it's very difficult to survive. So, and the nice part now is that $700,000 is all paid off. Another real positive thing happening is we're being asked by other entities to provide more staff. That's it now. They want to hospitals that hospitals they make all in this area. Our asking is to work out contracts with their staff. And clinic is also in this area and also contends that more they're interested in working with the plus when we're talking with another service waiting for it. Provide services for that kind of thing. So, I think we're doing the things that we're working in the right direction. I think that we have all the services so that it doesn't matter if you and get our services or what you have insurance. You're still going to go forward with services. And you're going to get your service on time. The other thing that's really interesting is our suicide rate. You'll just find charts and you'll find a lot of information on that. But our suicide rate last year was down from 20 to 22. So we're trying to manage to bring that down. And I think we're somewhere in the 5 range for this year. But that's significantly lower than
Any questions? Comments? That was good. Thank you. I believe that's on the list, but I see Mrs. Strong and Thompson here.
I'm here on behalf of the 377 board for care of persons with developmental disabilities. The representative from the ARC of Iroquois County, which is one of the agencies funded through the board, could not be here, but she did send quarterly reports for each of you. So take one and pass it down. Their agency has updated a brochure. She wanted you to have that. And I've got 2 copies of the audit. That's what's usually provided. There are additional copies of the audit if you care to have that additional paper. Tina Taggart is the director for the ARC of Iroquois County. So these are her business cards. And she will plan to meet with you in August. The 377 board was established in Iroquois County in the 1960s, and its sole purpose is to provide or contract for facilities and services for persons with developmental disabilities. We have been meeting annually with the 2 agencies that are both nonprofits that are funded through our board. That's ABRA, and we heard from Sue earlier. And I think Sue failed to mention that their agency funds this year. That is quite an accomplishment for them. There are 3 members on our board. In addition to myself, John Sumner is our treasurer. Steve Knapp recently resigned from the board after 15 years of service. So if you see Steve, please extend our appreciation to him for having served in that capacity. The 2 agencies funded through the 377 board each provide quarterly reports to the Board for Persons with Developmental Disabilities, their annual audit and quarterly financial statement. So together, the two funded agencies are serving approximately 150 adults with developmental disabilities. These are mostly individuals who have gone through the special education system of the public school, and once they're out of school, then they connect locally with two agencies for ongoing support services and training. The history behind funding for persons with developmental disabilities pretty much mirrors what Dr. Hoskins outlined for the mental health system. Seeing a service system that was institutionally based for many years, and now because of the 377 board and restructuring of program options at the state level, we see community services for people with developmental disabilities. So that allows these individuals to stay with their families, or at least in their communities, and the care and treatment provided for these folks is far superior to what we would see in the system of institutions. We want to extend our appreciation to the county board for continued funding for these two organizations. Last year, the 377 award levied $471,515. Now that was distributed to the two agencies. We make that distribution based on an unduplicated client count between the two agencies. So 97% of the funding goes to the Ark of Iroquois County, and 3% then to Amber. So I'm currently working with Kyle Anderson, reviewing some possible candidates to fill the vacancy created for Steve Knapp's resignation, so that we can carry on the good work that's been going on many years through this board.
You have applicants or still seeking applicants?
Mr. Anderson asked me to speak with 3 different people, which I've done, and now it will be up to him to decide who those 3 to approach, and we got 3 positive answers on that.
That was very good. Any questions? Comments? None? Is there anyone else? Mr. Thompson?
Just for some. I'm Dr. Hopkins, I'm actually the director of the Iroquois Mental Health Center. The Iroquois Mental Health Center is a corporation appointed by the county board, so we are not a corporation. Technically, I think we're not an agency because we don't have any employees, we don't pay any unemployment, we don't take any salary or per diem or mileage. Everything that you give us goes directly into funding for the purposes that the 708 board exists, and essentially everything that we have is being funded through here by the Mental Health Center, which we feel very happy and lucky to have here in Iroquois County, because many things have been improved in the last 10 years. The facilities have been greatly improved from the old cement plant that Russell Bill's going to tell you about. I met over there for a long time, and it was just, well, the best we could do that. So things just kind of happened into a lot better facility. When they got over there, some, I guess you'd say, procedures needed to be instituted to make sure that drugs were where they were supposed to be, and that there were exactly the right number of pills in
certain bottles, and that was tightened up and taken care of. There was a question as time went along as to how efficient people were being, because there was a backlog that Dr. Hopkins talked about, and he got on that, and you'll see in the handout that he gave you that their efficiency is well up, and people are seeing much quicker now than they ever were before. Also, there were some very difficult qualifying agencies out there. One of them was called CARF, and that was a big thing, to be qualified by CARF. It made you eligible for a lot of other help that you could get, and that meant that the funding sources expanded, and that the pressure on the other funding sources was accordingly decreased. So they worked very hard at that. There were some organizational changes or some operations that they fine-tuned, and they got it. And that was really a big step. So that has contributed greatly to the expansion of funding sources that has occurred. And I think that's working all to the benefit of Iroquois County. We're appreciative of how you fund us every year. We don't have any budget except from you folks. All of our expenditures are tracked by the county treasurer. I believe we do have a separate checking account. It takes 2 signatures to pay out, but essentially what happens is that the levy comes in, usually in June, July. We get a big lump of it then. We make a large distribution to the county Iroquois Mental Health Center then, and then we'll make another one later when we get there. We don't think that we're getting anything leaving it in a bank. We're not making any money that way. And so our position is that we just put that money out there and get it working. And it's been working well for us, we think. So we're happy with the way things are going. Dr. Hopkins mentioned that they are making contact with other medical facilities in our immediate area. We feel comfortable with that, rather than if we didn't have any mental health center here, people were coming in from the outside and providing for whatever they thought they might be able to shuffle off to us here. Maybe they could do a branch office in Watsika, maybe they could put one in Gilman, maybe they could put one in Clifton, maybe one down below, maybe they could. But with the situation being that we have the center right in the middle of Iroquois County, and we are making overtures, and they are receptive to it, of getting the services farmed out from us if things work out right. We like that a lot better. We think that puts us in the on top of the heap. So the way things are going, thank you for the funding. We'll do our best with it. So we'll tell you how good things are now. Any questions?
Oh, thank you. Any questions or comments for Mr. Thompson?
Thank you.
You're welcome. Thank you. Any other reporting agencies? Dale?
I'd just like to make a comment. We're trying to bring this back, and I think it's an important thing, especially for the county board. I want to thank you folks very much for coming in and giving the information that you've given. It's enlightening to us as individuals, as board members, and now enlightening to the general public also. I think it's important information that the residents of Iroquois County especially don't know any other way in general, and I think it's great to have these reports and we'll look forward to ongoing reports and contacts in the future. Thank you very much.
And I'd like to add to that, thank you for attending. I know, I got on this board, I didn't know a fraction of what I know now about these agencies, and I still don't know enough, but I'm learning, and I think they're being managed well. We need to keep that relationship going so there's transparency and the money's going to good work, good use. Anybody else? Okay, we'll move on to the next item of business, and that's the Public Health Department.
Last month, I gave you a grant and contract update, so here's one for this month, so that you can pass it around and see where we're at as far as our FY16 grants in comparison to our FY15 grants. Those grant amounts are, you can see some changes on there. For example, you can see almost a $5,000 difference in the WIC grant. We're still waiting to hear from the Healthy Families Illinois grant and the Family Case Management grant. Those three programs, WIC, Family Case Management, and HSI, are the programs, thank you, that we subcontract to IMH. All the rest of the grant programs that you see on this list are direct services out of our office. So we're still waiting to hear from those, from the Department of Human Services on those two grants. I think it largely depends on the governor's budget. Once that is, those grants have been provided to us, then we'll be able to review our contract with IMH. The contract with IMH does expire on June 30th, so hopefully we'll have something in place by that time. Did you give me the other grant amounts? They're pretty stable. I was notified this morning that the Public Health Emergency Preparedness Grant, which you can see we received $40,500 and whatever, that was level funded. So I did receive that grant amount this morning via email, so that's the only one that's not on your list. But as we're getting them in, we're writing them in, and so far, we've been very fortunate that every grant that we've applied for has been received. So we're very, very fortunate. And then the next thing is our summary report of all of our services. And that talks about the environmental health services, the community health services, and the senior services that we offer. So there are reports, and it's a long list of services that we provide. So rather than read it, I'll let you just look it over. So, as you're looking over the services and over the grants, there's the same reports that I hand out every month. We do have a brand new grant that we did apply for and received, and actually that was that on that. And that is a capacity building grant. And it's a grant through the Adult Protective Services, but it's a grant for individuals in the community who have substance neglect issues. So I'm going to let Luann just give you a very brief overview of a little bit about that grant and what we're going to be doing. Whatever you feel comfortable doing.
Well, I gave you kind of an overview of the Adult Protective Service Program in the last meeting. And at that time, we thought the Department on Aging was just going to have a couple of pilot projects throughout 3 days because it's a requirement in the Adult Protective Service Act that they start addressing South neglect. Because they're tired of individuals like lack of utilities, rodents, and animal infestation. I think they use real personal behavior, a lot of it. Problem is with housing issues, safety issues, the borders, but it can also be lack of medical care. But to make a long story short, rather than trying to initiate this other project in the state. We got short notice that instead it was going to go statewide. They offered capacity grants to start building this program to address the issues of neglect. So in order to do so, we submitted and received approval of the grant that between now and June 30th, we need to develop an interdisciplinary team, which would be fire department, clergy, provider agencies, township officials, that we can get together animal control to identify what the limitations are now and what the roles of different community partners are, and how can we address this. So we want to have a meeting, if anybody that's interested, contact me on June 17th, and I'll send out a informational flyer on that. We also have to build an access system. The grant committee asked staff, but we're utilizing it currently, so we don't know what the big setbacks are going to be with our other programs. But Cheryl's helping us develop a program that can store how many of these cases have animal control issues, how many have housing issues that need to be addressed. Unfortunately, we won't have all the answers. How do you do something? We don't have the funds for these days to take care of some of this, but between July 1st and January, we'll continue to build this team and community awareness. How do we address the outcry of the community needs this and demand something be done when it was a long time to get to this point in terms of pictures overnight. In January then of next year, we plan to start using, having a program in place to start responding to these cases, which we respond to now, but the best we can, and making contact with the individuals and their immediate needs. Hopefully we'll be able to expand the program and we'll be talking more of adult protection services. Any other questions?
Dan has one.
Yeah, I have one. Under this tuberculosis program, pardon?
Yeah, go ahead.
Under the tuberculosis program, new cases investigated. Two, somewhere around April 15th. What happened to those two cases?
The first case was a Green County resident who came in the health department at the recommendation of their private physician, and we did a TB skin test and it came back positive. And it was what I call an angry positive. It was over 10 millimeters. So we sent them to the hospital for a chest X-ray. Now, Iroquois County is a provider of last resort. So what we do is, if they have private insurance and they don't have a medical doctor, we try to get their medical doctor to write the order for a chest X-ray so that their insurance can be billed and Iroquois County money on expended to do that. In this gentleman's case, the provider had only seen, the provider that sent him over had only seen him once. And after a big investigation, we found out that he had probably been exposed to tuberculosis many years before, and so I was assuming there was probably a good chance he had latent TB, not active TB, but latent TB, so probably needed a preventive medication. He also happened to be eligible to be seen at a VA, but we couldn't get him an appointment at the VA for like 10 days. So even with kind of a whole bunch of strangers, we didn't get an appointment. So I didn't want him walking around here for 10 days in case it was an active case. So we paid for that chest X-ray and sent him to Bremen-Moore Hospital, and the radiologist read the X-ray, and the X-ray was negative. But he had some scarring. So in his lung. So we decided we would go ahead and do sputum specimens on him as well. We collected 2 sputum specimens 24 hours apart, and sent them to the state laboratory, and those came back negative. So he is not an active case because he is being treated for latent tuberculosis, which you've been exposed to it, probably harvest bacteria, but it's not actively able to spread it to others. So we've prevented and that is through the VA now. The other case was an individual who is a converter, which means that they previously had many negative TB skin tests, but came in and got TB skin tests that turned positive all of a sudden. We always tell people not to panic, that they don't convert to a positive test, that they've probably been exposed to tuberculosis, but probably do not have tuberculosis. And in that case, they got private insurance, the private insurance paid for a chest X-ray, the chest X-ray came back negative, and the physician took over that case and they're being treated by the local physician. But those cases take a lot of work and a lot of investigation and a lot of phone calls, because our primary goal obviously is to make sure that there aren't people walking around or spreading TB from one person. So it takes a lot of man hours, but we follow up on every positive TB test that we have.
Well, that's really a serious issue.
It is. And we really don't consider it an investigation until the chest X-ray shows anything in referral follow-up. And then we have to talk to students and so forth. But a lot of people test positive, and some test positive. So the investigation is when that chest X-ray comes back and we have more follow-up after that.
Thank you very much. Explained it really great.
You see on the list that we do a lot of services. We have inspected restaurants and do wells and septic and municipal disease investigation. We do like dental penal program, and the list is 8 after 8 of the services that we offer.
Any other questions or comments for Dee?
Thank you.
Thank you. The next item of business is old business. So old business. Oh, I'm sorry. Skip the claims. Has everybody had a chance to review the claim sheet and or look at the claims? I would entertain a motion to approve. Moved. I have a second.
Second.
It's been moved and seconded. Any discussion on the claims? There's no discussion. Can we call roll?
Schultz,
Yes.
Schmid,
Yes.
Kersley,
Yep.
Crumley.
Yes. Motion carries. Now we move on to old business. Is there any old business? Is there any new business? If none, I would entertain a motion to
Move to
adjourn.
adjourn.
Second.
Moved and seconded. Discussion? All those in favor?
Aye.
Same sign.